Hello, my name is Dr. Mike Smith and I'm a senior academic at Cardiff University in the UK. And I'd like to thank you for taking the time to access the publication that colleagues and I have recently had republished in the PoGP journal entitled Point of Care Ultrasound in Pelvic Health, Scope of Practice, Education and Governance for Physiotherapists. A major focus of my academic work is on supporting different professions, clinical specialisms and healthcare settings with the integration and consolidation of point-of-care ultrasound into their clinical practice. In this regard, the use of the PoCUS framework approach that I developed allows for the integration and alignment of scope of practice definitions, education competency, and also governance components, allowing for both progressive and robust delivery of point-of-care ultrasound in healthcare specialisms. These first of their kind publications provide groundbreaking clarity for clinicians and their managers with regards to the use of point-of-care ultrasound in pelvic health. Whilst the paper has been written with an emphasis on the UK situation, we very much hope that regardless of where you are based, and indeed regardless of the specialism you work in, there will be elements that you can draw upon to support you with your own clinical practice. In this regard, I work with a range of different clinical specialisms, professional groups, and healthcare settings. So if you would like support with development of your own bespoke solutions, please do get in touch. I'll now hand you over to my esteemed colleague Jane Dixon to explain more about the elements for their application for pelvic floor physiotherapists using point-of-care ultrasound. Thank you.
Hello everyone, I'm Jane Dixon and I'm the current chair of the Education Subcommittee of PoGP. I'm now semi-retired, having worked for over 40 years as a pelvic health practitioner in the NHS and the private sector, and as an advanced practitioner for over 15 years. I began using ultrasound scanning in my practice in 2002 and started teaching other healthcare professionals to scan in 2006, around the same time as a group of us set up the Dynamic Ultrasound Group for Physiotherapists, and we called that DUG. In 2013, DUG amalgamated with the Electrotherapy Professional Network of the CSP, and at that time it became evident that as more and more physiotherapists began using PoCUS within their practices, it was necessary to provide some guidance on training and expectations and competencies to practice. When we wrote the paper, we knew that we had the potential to change practice and enhance patient care for pelvic health patients. PoCUS had already changed our practices. The patient pathway was shortened as we were now becoming first contacts rather than waiting for consultants to assess and refer. Not only were we able to improve our understanding of pelvic floor dysfunction, but our assessment and treatment protocols and goals were changing as well. Plus, the education of our patients and their understanding of their problems was also benefiting. Patients became more positive about their rehab and certainly more compliant with their exercise regimes. However, we needed to leave no stone unturned. Whilst anyone can start scanning and using an ultrasound scanner, and in the early days that's how people started, and I certainly started that way, we now live in a very litigious environment, and it's important to convey the need to realise that whatever modality we use as physiotherapists, we must be properly trained. As we say in the introduction to the paper, education and governance considerations are detailed in the paper to ensure the robust and safe use of the modality. In-depth training will enable PoCUS to be within scope of practice, supporting all areas of clinical practice. Also, we needed to highlight what we don't know and what we don't do, and giving consideration to the importance of having protocols in place to cover all eventuality. Whilst the paper is addressing UK physiotherapy practices, we hope that the information can be disseminated across other healthcare professionals working within pelvic health services, perhaps even in other countries, and provide the framework they need to integrate ultrasound imaging into their practices. In parallel to this document, we've worked with the CSP to produce guidelines and an information paper identifying levels of training needed to enable users to identify where PoCUS sits within their current practice. And whilst we're aware that there are many pelvic health physiotherapists who have been scanning for some years now, we would encourage everyone to read these documents, critically evaluate their own training and levels of competency, and be able to demonstrate that their practice will stand up to scrutiny if necessary. Please feel free to contact any of the authors if you have any queries at all. We're all here to help.